The year 2020 will always be sadly remembered as the year of the COVID-19 pandemic. It has left millions across the globe in a state of despair. Along with the entire world, as Bengal on the eastern part of India was struggling to fight against the pandemic, Cyclone Amphan, one of the worst disasters, had landfall in the southern coastal areas of Bengal, which witnessed the most widespread damage caused by this calamity. The cyclone produced sustained winds of 112 kilometers per hour and gusts to 190 kilometers per hour, which was recorded by the Weather Observatory in Kolkata. It damaged homes and uprooted trees and electric poles. Embankments in the region were overtaken by the surge, leading to inundation of the islands. The saline water rushed onto the narrow village lane and the farming fields, making it uncultivable. Stories of devastations spread across the entire region have been horrifying. Lives will never be the same for many. Lakhs of families struggle to make ends meet as their livelihoods are now paralyzed.
আমাদের বাড়ি ঘরদোর সব চলে গেছে। যখন তখন দেয়াল চাপা পড়ে যেতে পারতাম, কখনো দেখছি টিন উড়ে আসছে, কখনো অ্যাডভেস্টার উড়ে আসছে, কখনো
আমার বাবা মরে গেছে, তুমি কাঁদছো কেন, তুমি কাঁদছো কেন বলছে।
মানুষের যে জীবিকা কিভাবে চলবে, বেঁচে থাকার মতো অবস্থায় আমরা হয়তো আর নেই।
Responding to this crisis, members of Shri Sathya Sai Aarogya Vahini immediately focused their attention on the helpless and destitute in the coastal areas of West Bengal, affected by the double onslaught. With single-minded focus regarding relief and build-back work, the masked crusaders navigated the extra mile amid high tides and rain to reach parts of coastal West Bengal with adjoining submerged villages and islands, only to witness the devastation caused by Amphan amid COVID-19 conditions. The team offered the most essential baby foods, dry ration and tarpaulin, and also the most sought-after drinking water, the elixir of life.
একটু খাবার জন্য নিজেদের যাতে পরিবার চলে, নিজেদের সংসার চলে, সেইটুকানি জিনিস নেওয়ার জন্য তারা নদীতে সাঁতরে আসছে। বাচ্চাদের পরা জামা প্যান্ট নেই, বাচ্চাদের খাবার কিছু নেই।
The amount of devastation that has happened in these areas are really heart-wrenching to express. Mainly when we see the children fight it out against hunger, we really can't hold ourselves back to come out of all adversities.
Reaching these devastated villages was not easy for the team. While roads were blocked with fallen trees and electric poles all through, the water routes with the tide timings decided the fate of the journey, as river water receded from its distributaries in the interior's islands, forcing the boats to halt amidst pitch darkness in the marooned coastal peripheries. Affected areas were unhygienic for survival, particularly without food, toilets and shelter. Victims had no options to cook, as kitchens were either submerged in saline water or non-existent. Even raw groceries were of no help. The messengers of love on a war footing attended with trucks, and the Aarogya Vahini ambulance at the coast with loads of groceries and medicines. The team had set up relief community kitchens to support meals twice a day to thousands every day in different coastal locations, continuously supplying villagers with food, traversing on foot and bicycle, and later by boat, or somehow struggling through the saline waters.
There have been no opportunity for people to even cook in their houses. So actually when we've started off setting these relief kitchens, even the trucks could not reach these places in the interior belts.
To boost up immunity in the communities to combat the current pandemic, a well-calculated, clinically guided approach to offer nutritionally well-balanced supplements was planned and executed in the coastal belts of West Bengal. From the nutrient boost base set up at the camp, Each mother with her infant was handed over essential pulses and grains, legumes, nuts, soybean, milk powder, bananas, and guavas with a pack of sanitary napkins as sanitation for women was addressed with a prime focus. For the growing children, Sai Sure, a malt-based multi-nutrient supplement composition for children, was also distributed with milk to address the dire needs to combat malnutrition amongst rural children. Nutrition for mothers with newborn babies during their discharge was also offered in the form of health drinks, with essential commodities and monthly rations to minimize incidences and probabilities of hospitalizations in such trying times. Members of Aarogya Vahini reached out to remote locations in 7 districts of West Bengal. Amidst restricted movement, supplies, limited manpower, and health concerns, the team tried to reach out with essential supplies like food and milk, ensuring meals for thousands of households with geriatrics, newborn, out-of-work day wagers, also trying to strengthen kitchen stores in remote belts. Migrant laborers traveling across states were addressed with dry food and essential commodities on the highways from Aarogya Vahini. Rural chronic NCD patients with hypertension and diabetes were supplied with maintenance medicines every month. The focus of the team has been on the capacity building during the primary screening throughout the year for the community health workers. These rural youths played pivotal roles in endpoint delivery of medicines for chronic patients, maintaining physical distancing and at the same time executing the needful act in facilitating the monitoring of such chronic patients through telemedicine. The Aarogya Vahini team also facilitated the creation of zero-contact COVID kiosks, ensuring the reduction of morbidity in such times of highly contaminated environments. Ensuring safety of health, Aarogya Vahini came forward with installation of sanitization tunnels also in hospital compounds. The team delivered personal protective wares to ensure the safety of the COVID warriors in umpteen health institutions for doctors and health workers who were fighting as selfless warriors at the clarion call of society. The team members tried to promote community hygiene through awareness and sanitization with live demonstration in the camp areas. Physical distancing and use of protective gear, both for caregivers and beneficiaries, have been taken care of. Specialty outreach camps offered consultations to women and children. While children were screened with a cardiac stethoscope, mass awareness with digital tools were made at the waiting area regarding lifestyle management during the current times, explaining to them hygienic ways of living, regular usage of hand wash, usage of masks in daily life, and also ensuring physical distancing. The team was humbled upon being bestowed with the prestigious Dr. Abul Kalam Award for excellence for contribution towards nation building.
A very special awardee here. As you all know, despite the COVID-19 crisis and this severe cyclone called the Amphan cyclone in West Bengal, there was this organization called the Sai Aarogya Vahini Trust. We will request Mr. Subhajit Roy, who is part of the Sai Aarogya Vahini Trust, to receive this award, please. Can we have Mr. Subhajit on the video, please? Yes.
Thank you. Thank you so much.
Wonderful.
Really humbled.
Throughout these difficult months, combating health and social issues, the Aarogya Vahini team is ready with greater power and courage to give back to the soil that they were born on. The journey of the Aarogya Vahini began on the 90th birthday of the founding father, Shri Sathya Sai Baba, with a vision to create access for completely free of cost primary health services. With conceptualized and innovatively fabricated mobile medical vans equipped with high-end innovative and portable medical equipment and lab kits, Aarogya Vahini has traversed a path reaching each milestone year on year. With its footprints in West Bengal, Jharkhand, and Assam, the team envisions towards societal transformation through compassionate healthcare by touching lives through healing, garnering partnerships with esteemed institutions and organizations. Through screening, detection, confirmation and treatment with its referral network in facilitating tertiary surgical procedures completely free of cost, even during the pandemic. With a dream to be the most vibrant field force in rural India, Shri Sathya Sai Aarogya Vahini resolves to provide quality free of cost health for all as our offering towards the glorious task of building modern India.